Ladies and gentlemen, good evening to you and welcome to the annual general meeting of the East and North Hertfordshire NHS Trust.
Buzzing. Friendly, happy, nice atmosphere, everybody's interested.
Positive. Lively. Inspiring.
It is really good.
I would say it's enjoyable.
Yeah. Everyone's full of knowledge, so if you can just stop anyone and they know what they're talking about and they're interested and they're engaged.
My name is David Greenhill. I work for Age UK Hertfordshire.
I'm Sarah. I'm the dementia specialist nurse at Weston.
Patient experience, so that's the good and the bad.
I actually work as part of the home and hospital discharge team. We're based at the Lister Hospital and also the urgent care centres. We might do things like shopping and picking up prescriptions and doing those other things that people might find it difficult with.
It's quite busy. There's a lot of people here, which is good. Lots of different services as well, so it's nice to mingle between each and every one of us.
I mean, I'm amazed how many people there are here. And I mean, I'm really looking forward to getting around to see some of the stores, sort of network with a few other agencies, get to know what they do and, you know, and vice versa, really.
They get bigger and better, I think.
I'm here today to represent Speak It's a Two-Way Thing, and it's mainly to enable patients to say, I don't understand what you said to me, and ask questions about it and feel like that's okay. We're at Equilibrium, and we're a group of Year 12 students that carried out an RSPH course to do with health in general, and then from what we've learned, we created a teaching pack. We've been endorsed by the Director of Public Health and RSPH.
But they were mainly interested with the laparoscopic trainer and the robotic surgery that we have.
Including your cameraman here, who wants to go?
Loads and loads of different stalls. I want to go round them all myself, but obviously I want to promote my own ones. There isn't time to go round them all, but there's loads of information out there. Fantastic work that people's doing, I feel.
Different age groups, it's fantastic. We've had lots of school children that have come round as well, but we also have some pensioners here. We've been holding sticks while they've been having a go. It's fantastic. We've been really enjoying it.
It was different, it's not what I expected, but interesting. I expected minutes and matters arising and that sort of thing, so I was glad it wasn't like that.
People today have put more constructive questions forward instead of their personal issues.
I'd just like to say thanks very much to everybody. It was a really informative evening, very, very well organised.
So this is Louise's first AGM. It is. And following, as we came out, you said to me
that I thoroughly enjoyed it.
And it was very informative.
It was very informative. And everyone's been really friendly, everyone's been really, really nice, and the setup has been fantastic.
For me personally, I just want to make a difference, and if I can attend these events and give my views and try and make a difference, then that's what I think it's good to do.
We're doing okay. Yeah, we're doing okay. This is the Macmillan Cancer Information and Support Centre at the Lister Hospital. It's a drop-in centre for anyone with any queries, questions about cancer at all.
That AGM was a really good example of just how wide everything is, and I think we all learned something by going along.
It just made you so much more aware of what should we be bringing in here into an information centre. What support do we need to have? Who could be the champions in here for that? And we've already thought about that with the learning disabilities. So from that AGM, other things have already started to happen.
Every year I'm absolutely amazed. It gets bigger and better. And every year I think, how can this be better? But the next year it seems to be better.
Age UK Hertfordshire, we have lots of services. We're based in the hospital, so we support people coming out of hospital. The AGM has grown so much over the last couple of years. I can remember going to a very small event for the last about 8 or 9 years, and this was huge and wonderful. It's so important for us that we get to know lots of different people in our organisation, so we can provide the best support for our clients.
For me, it's like reaching out to the public and showcasing what we do.
I think we're very proud of what we do up here, and we are quite set aback from the rest of the trust, and it is nice to be able to show that to other people and to see what we do. And some of the managers have been down since and said how great it was to see all the different people at our stalls.
What we're trying to do in partnership with the hospitals is we're trying to prevent people having to go back into hospital. We all know that the hospitals are overwhelmed with the number of people, so if we can help in some ways, that's what we're here for.
Age concern there, Hertfordshire Health Walks, Carers, Hertfordshire. You know, it was lovely, they came up to us and we all knew each other, but equally there was other people coming up that hadn't spoken to us before, and even trust members that perhaps don't know what we do in this sort of drop-in centre. What does it all mean? It's an ideal opportunity to meet and talk with other organisations, and that gives us the ability to support our clients in so many different ways.
Thank you very much.
Thank you.